I did another video on this, and I can tag you in that. The lighting's not good, similar to how it's not great this morning. But I think the thing that people don't realize is that at this point, the only way to solve the problem now is to go to a universal healthcare program. It is to take private healthcare away and make everyone pay essentially more taxes to cover health insurance. And if people are fine with doing that, that's great. But I can tell you, I live in the state of Colorado, and they want government expansion in pay of certain things like teacher salaries, fire and police salaries, and they also want road improvements. But they won't repeal what's called Tabor law. And the Tabor law controls the state budget. And since teacher salaries, road improvements, and firemen and police officer salaries are controlled by the state budget, Houston, we have a problem. It's called a complete ignorance and lack of understanding. And a similar thing is happening with people who don't understand what has happened over the course of time in health insurance and health care in this country. And the truth is, there's not a great fix to anything except, okay, we're going to make all the insurance companies go back to being not-for-profit. We're going to make every hospital not-for-profit. Now, private practice medical owned by a person, not a company, not a corporation, not a third-party organization. Like, I own my own practice. That doesn't have to be not-for-profit, but corporate-owned healthcare should be. Does that make sense? And the reason it should be is because the only people who benefit are the people who own the company. And in some cases, that's the surgeon or the physician because they own a portion of the company. But the majority that benefits is actually the corporation that owns the company, and patient care declines. So if we go to a universal healthcare system and we make all the hospitals not-for-profit, and we make all the corporate healthcare not-for-profit, then we start to see real change, right? And if those corporations don't want to go not-for-profit, that's fine. They just don't have a contract with the universal healthcare provider. And if you want to see that provider, then you have to pay cash, which then again goes back to the problem that we're going to have very soon, because the subsidies are going away and people's insurance rates are going to jump anywhere from 15 to 38%. And again, healthcare will be only for the rich. And what I don't understand is why we think that that's okay. Why do we think that's okay? I myself personally am still paying an emergency room visit bill from my son from almost 2 years ago now. Still paying it. On top of the fact that for my education, my doctorate in my clinical doctorate in physical therapy, I'm still paying student loans. It's very broken. But what's going to happen January 1st isn't going to help. And I very much grew up in a situation where there was not enough to go around, and there were times where I wouldn't tell people I was sick until I was like really bad. Really bad. Because I knew it would cost my parents money to go to the doctor. Money we didn't have. And no child should ever be put in that situation. And there will be children put in that situation come January 1st. Both sides are wrong in what's happening. You need to give the executive branch more power and slowly stripping away our rights, our Constitution, is not okay. And you need to include cosmetic surgery for people who don't know who they are in health benefits is garbage. And if we didn't have for-profit insurance companies, we would not have deductibles as high as they are. We would not have premiums as high as they are. If we hadn't started with employer-mandated health insurance in 1979 with Jimmy Carter, we wouldn't have insurance premiums at what they are, and we wouldn't have deductibles at what they are, and we wouldn't have copays at what they are. I'll tag you in the other video.